right, we have a 36-year-old woman. Her main complaints are severe anxiety and delayed menstruation. Let's see here. So I've been seeing her for a while now. The anxiety uptick has been more recently. She came to me about 4 weeks ago because it just started to kick up with panic attacks. So the last time I had talked to her, she was in a pretty bad place. She would wake every night around 2 o'clock, really hard to fall back asleep. Falling asleep fine, but then waking up at 2 and then sweating through the night and soaking through her clothes.
Okay. What patterns do we have diagnosed for her?
So we have liver depression, liver depressive heat, and blood vacuity.
Blood vacuity? Okay. Does she have any dampness or phlegm?
Yes. She sent me her tongue picture.
Okay.
And it's a pretty big mess.
Okay. We'll post that below.
Okay.
Tongue picture below.
But just to verbalize that, it's pretty thick, patchy coating, very yellow. The rest of it, some purple in the body, and also definitely heat, so redness in the body under the tongue and on top. The edges are a little jagged. I guess you want to take a look at that.
You'll see these puffy portions on the side that are indicating more liver depression pushing out. Yeah. Is this tongue? This is relatively new for her.
Yeah, this is her last one.
Okay.
She actually had shown improvement in the tongue coat the last time we spoke, but this past few days, the only thing that's been different is that her stress has gone up.
Okay.
With work.
What did we have her on for herbs before?
So this last formula we had her on so we did 2 formulas. One was Buchong Ichitong for about 3 days because she had been on Sanrentong for a few weeks at that point.
For the dampness and
for the damp and the phlegm and the heat.
Okay.
And so we decided on doing 3 days of Buchong Ichitong to just supplement her spleen a little bit, and then we went back to 70% Sanrentong, 10% Chaihu, 10% Yinchen, 10% Herhuanpi.
And how did she do on that at our latest follow-up?
So latest follow-up, she actually said she's had no panic episodes. It's been about 2 weeks.
Good.
Since the last discussion.
Okay.
Hasn't had to take any lorazepam, which is big.
Good.
She's still waking at night, usually about between 1 and 2. But she's not sweating.
Okay, good.
Sleep.
Good. So typically when a patient has trouble falling asleep, that's usually more of a replete or an excess pattern, usually liver depression or something along those lines. If a patient's having trouble staying asleep, it's usually a vacuity or a deficiency pattern. In her case, we know that her spleen is weak. So my advice, given how well she's been doing on this, is to continue fortifying and supplementing the spleen because her sweats are going away also. So that would be my plan. And that's currently what we're doing, right?
Right. And she did report also, because before she had like no appetite. She had lost about like 7 pounds in a week, and she's already very tall, very thin. So she did report this. Now her appetite is much better. She's actually feeling hungry.
Good.
Something unusual though is that when she wakes in the night, sometimes she's actually hungry and needs to eat like a piece of fruit.
Okay.
But and still a little, still having some anxiety, but no panic attack.
Much better.
Yeah.
Okay, good. So we stay the course.
Yeah, we're going to stay the course.
Fantastic. Okay, very good.